from the NeoShell 5 network. This is the Takacs McGinnis Elder Care Law Hour.
Hello everyone. Welcome to Takacs McGinnis Elder Care Law News Hour, where we explore issues that can arise due to aging, chronic conditions, disability, and unexpected illness. In today's show, we're going to talk about advanced care planning and end-of-life decision-making. I'm your host, Tim Takacs.
And I'm Barbara McGinnis. In today's episode, we're going to be talking about a very complicated issue of advanced directives and end-of-life decision-making. We're going to have several guests that's going to bring unique perspectives to this topic. We're going to talk to hospice providers, nurses, social workers, but we're going to start first from a physician's perspective, and we're going to welcome Dr. Chet Gentry, who is board certified in family medicine, palliative care, and hospice care. He's the founder of Innovative Family Care in Cookeville, Tennessee, and he's been the medical director of Hospice, Caris Hospice, since 2012. Welcome, Dr. Gentry.
Thank you, Barbara.
So let's begin with just setting the stage. What are some of the definitions, and what does advanced care planning and end-of-life decision-making mean to you, and how does it influence your practice?
Advanced care planning is basically, with respect to end-of-life, trying to take a proactive approach to ways that we might experience end-of-life, especially from the medical standpoint. We can't always predict that, but we try to facilitate preparing the patient and the family for what may come as the diseases that they have evolve. We try and present them scenarios of how the end of life might come and allow them to think about it and make decisions so that as much as it's in their control, they get to do the things that are important to them before they die.
So it sounds like more conversation driven, that it's important to actually talk with your primary care provider, and not as much document driven as attorneys might like to think.
Right. In my experience, we don't so much, I can only think of a handful of experiences, and that's where there was a conflict of opinion, where the documents were actually the deciding factor. What's far more important and effective is that we encourage people to have the conversation about end of life. Sometimes that's hard to think about. Nobody wakes up this morning and thinks, I'm going to have an end of life discussion or talk about death, but everybody, I find that most people know exactly how they want things to be if the situation is presented to them, but people are not always prepared for the different situations that might occur. And so it's the conversation, what I find is it's the conversation and going through that process with their family members that makes the difference in what actually happens. That has a greater determination than the document itself.
And what we like to tell our clients is that as we help them prepare the documents, to be sure to have the conversation not only with their named agent, the person that they're going to task with being their advocate when they can't vocalize their decisions any longer, but also with their primary care provider. And do you think that now that Medicare is helping to reimburse for those conversations, that it's more inclined for physicians to have the conversation with their patient?
I think it's made more physicians think about it because there's a formal expectation that we do it and reimbursement for it. There are significant barriers, though. It's a very difficult conversation to initiate, especially when that's not a topic, and trying to do it proactively. But I think it is having an influence in healthcare, in our willingness and motivation to have the conversation.
So how do you start these conversations? I mean, do your patients just come to you and say, Dr. Gentry, you know, I'm feeling unlucky today, you know, and maybe we should have a conversation about advanced care planning or end-of-life decision making. How tell us a little bit about how that unfolds in your office.
In the early days of my career, and I think in the industry, most of us would be reminded as we see chronic disease evolving, and that might prompt us to have the discussion, even if it's down the road. But now that we've paid more attention to it and we see the importance of it, I've been fairly deliberate in thinking, okay, which healthcare providers should be the one to have the conversation, and naturally I think as a primary care doc it should be me. And then the next question is when. You know, if somebody's relatively healthy, I may only get one shot at them in the annual physical. So I've incorporated it into the annual physical of what we do, and I initiate that conversation as a routine thing. And sometimes I have to remind them, we're not having this conversation because I'm expecting, I know something that you don't,
right,
but that this is just routine care. So there is a place that I have it, and also sometimes when we're talking about the implications of chronic disease, I will bring it up.
Now Medicare has the, as Barbara mentioned, Medicare now is paying physicians to talk about advanced care planning.
Right.
And it sounds like you have been doing that for a long time.
Yes, I was trying to do that deliberately before the reimbursement came, and so this is one of those many things that we used to do unreimbursed because we thought it was the right thing, and that's just frankly helping a lot of primary care docs stay open to be reimbursed for things that we've been doing for a long time.
Now, physicians who see a lot of Medicare patients, like you do, I'm sure, in Cookeville, are you seeing a lot of patients, maybe younger patients, who are just starting on Medicare? And I know some people don't realize that Medicare has a welcome to Medicare exam.
Right.
You know, and are you sort of bringing the conversation in as a part of that? Or is it just something that you've just sort of naturally been doing?
The welcome to Medicare exam is sort of we dovetail that into the first annual physical, and so that's sometimes their first exposure to a healthcare provider prompting them to talk about end of life, but that's when I try to do that.
Are you finding that that's sometimes the first time they've actually talked to a doctor at all about advanced care planning?
Yes. And sometimes later they'll say, well, you know, I wasn't expecting to talk about this, or it's interesting that the responses that we get. It's always, there's an awkwardness even for me, and I've had the conversation many times to push through. But when we get through it, I usually ask for some feedback because I'm still learning. It's a challenging conversation to have, but almost everybody is glad they've had it.
Oh, that's good.
And of course, in the conversation, we're not insisting on a decision be made then. It's the beginning of a process, but it opens the door for us to complete the process.
And I think a process is a term that we use also with estate planning, that the entire estate planning process is indeed a process of evolution as your life changes. So would the advanced directive decisions. How you feel about care determinations today may be different tomorrow. It depends on, of course, many things. And so how do you help families and the patient itself start putting a framework around that?
Around the process of decision making. And kind of alluding to what you brought up before, the document to me serves as a marker that the process has gone full circle at least once. And of course, every year we bring it up again, but usually if we've done a good job and nothing has changed, they'll say, yes, that was my decision back then and I'm not going to change anything. But I start the process when somebody's getting ready for a physical, we ask them to watch a video. I was giving this same spiel over and over and over, and then my staff would give it, and that was good. That saved me time, but I wanted it to be me and my words, so we made a video. And if they haven't watched it before they come in, they watch it while they're waiting
for you.
Yeah.
Right. Oh, that's very interesting, Dr. Gentry. We'll be back. We're going to continue this conversation with Dr. Gentry, and we're going to bring in one of the nurses from Nashville's leading and largest hospice provider. We'll be right back after this break.